Hello, everyone. Thanks for joining us here on Wave Listens Live. I'm your host, Brian Shalonsky. I want to wish you a wonderful start to your day, your afternoon here. We're live on location for the show today at Freedom Mini Dental Implants on Bardstown Road. We will be here throughout the show today talking to Dr. Regan Ackerman. She'll be taking your questions as well, so get those ready. We'll have the number on your screen to call, 502-571-5263. That'll put you in the queue so you can ask your questions of Dr. Ackerman. And with that, I want to bring the doctor in, joining us here live on location, your Bardstown Road location.
Yes.
Been here at this spot since the spring.
Yes, yeah, so welcome to my office.
It's exciting to see it.
Yeah.
Giving people kind of a look, too, at what would happen if you're booking an appointment. You come right through this lobby.
Yeah, definitely, yeah. And so this is our Fern Creek location. We're kind of in between Hurstbourne and on Bardstown Road, so it's a little bit more convenient for some patients. But yeah, so I'm at this office 2 days a week, and then we still have our Dixie location office on Mondays and Tuesdays.
Easy to get to.
Covering all of Louisville.
Exactly,
now,
to whichever one's more convenient. Let's talk, Dr. Ackerman. I love every time you're on the show to introduce people to what it is that you guys are able to provide, the services that you offer.
So the main thing that makes us different from most people is that I do mini dental implants. We call them a mini implant just because it's a smaller diameter implant, so it's a lot less invasive, a lot less healing time, and usually a lot less costly than the big surgical implants. And we can use these mini implants to stabilize dentures, get rid of all that denture glue, help people wear their dentures again, or get rid of the denture completely, or even just replace a single tooth with the mini dental implant. So there's a lot of different ways I can use these mini implants.
Putting patients' minds at ease, I can imagine, with all these options, to hear that just right out front, we're cutting down on some of the things that people probably worry about before they go into a procedure like this.
Yes, yeah, and a lot of what I do is give people an opportunity to have an implant when maybe they didn't have one before. Maybe they were told they didn't have enough bone, or they'd have to have a sinus lift, or it was going to be major surgery for them, or maybe they couldn't afford a surgical implant. So the mini implant is a great option for a lot of people, and we do a free consultation, and we make sure you're a candidate and have enough bone. But a lot of people, especially lower dentures, it's one of the most common things I do. People have been told they couldn't have implants. I'm able to use the mini implant, and they can snap the denture on that mini implant. No more glue. They can actually wear their denture again.
Such a bonus for patients here in our community that these services even exist. I want to show folks now, because I know we have some before and after photos of one of your recent patients, Patricia.
Yes, so Patricia, wonderful lady. So she came in, she knew her teeth were, obviously breaking down on her. She knew she needed to have all her teeth removed, but she did not want regular dentures. She knew she wasn't going to be able to tolerate them. She knew she needed a better option than regular dentures. So I was able to do the permanent teeth for her. So yeah, these are the permanent bridges. Yes, so night and day difference. So those are not dentures. They're permanently cemented in. She doesn't have anything on the roof of her mouth. She can taste her food again. She brushes them just like regular teeth. And I know we'll show all the models later, but so she did the permanent teeth, so no more denture, taste her food again, but so definitely help people in those situations.
Seeing that smile on her face, I can imagine that's what means the world to you when you're able to see that. Because I imagine some people probably spend time hiding their smile, and then when they get through a procedure like this, they can't stop.
Yes, yeah. I actually had a patient yesterday that came in. She had a lower denture, never wore a denture, and her granddaughter was like, "You always look so mean," because she was always trying to hide her teeth.
Right.
And then we did a snap-in denture for her, and she was like, "My grandson said I'm happy now."
Showing
so you're
their true
exactly
personality.
Right. Yes, not trying to hide behind that.
We love to see it. One of the things that we love to do when we're live on location, as we are today at the Fern Creek location, is actually give patients a sense of, you see these models, you see the before and afters, you say, I need this. What will it be like if I come in for a consultation?
Yeah, this is a great opportunity because you guys are here. So it's a free consultation.
Okay.
It's no charge. Just call, make the appointment. You'll see me. I'll be the dentist you see. But when you first come in, the first thing we're going to do is take a 3D x-ray. So that's our x-ray machine right there.
Live and in person.
It's very simple and easy. You just stand up straight in it, and it rotates around your head and takes the image, and then you back out. So very simple. But the 3D x-ray is pivotal in knowing if you have enough bone and to make sure you're a candidate for the implants. So that's the first thing you'll do is we'll take that 3D x-ray and then we'll go back to one of our operatories, and this is awesome. You got
such a beautiful office
here.
too.
Yeah. So we have multiple operatories. That's my lovely assistant and husband, John. And
I was wondering if he was hiding or coming into the shot.
He's helping us. So on the TV up there higher, you'll see the result of a 3D scan.
Wow.
So it kind of shows me your jaw, your teeth, if there's enough bone, the relationship. So that's the result of the 3D x-ray. So that's one of the things I'm looking at. There's a lot of different views to it, but to make sure that you're a candidate. And also the great things that we have here at the office is we have a scanner, which I'm sure he'll show that in a second, but where I can make digital dentures now. So a lot of people have old existing dentures and they want a similar copy of it. So we have a scanner where I can scan existing dentures and make a similar denture. So it's not a drastic difference to what you were used to. And it's also a little bit faster and stronger material. So, and we don't have to use the gooky impression material. So it's great.
It's great to see some of this, to see exactly the process of where you would go when you come into the office, and having the screens and the monitors there sharing the results almost as they're coming in. The patient is interacting with you and with their care in a way that probably, if they haven't been through this in a long time, didn't used to be offered in the past.
Right. This is, you know, a lot of new technology, but gives us a lot of information to be able to treat people in the best way and give them the best treatment.
We want to make sure, we got about a minute left before we go to commercial break. I want to make sure that we're going to be taking calls in the next segment. Again, 502-571-5263 to get those questions in to Dr. Ackerman here. So before we go to break, though, I know that folks always ask about downtime. After getting, I know every surgery is different, but after getting a procedure done, what's some of the typical downtimes?
So with the mini dental implants, it's no stitches, no surgery. So usually that first 24, 48 hours might be a little achy. I have a lot of patients that go back to work the next day, no problem.
That's what people love to hear.
Not a week off of work by any means.
You're getting ready to rock soon after with a new smile on your face. Okay, we've got a lot more coming up next with Dr. Ackerman. Remember, those calls, we're taking them after the break. The number 502-571-5263 to join us live on the air here at Freedom Mini Dental Implant on Bardstown Road. We'll be right back. We are back with you now on Wave Listens Live. Brian Schlonsky here with Dr. Regan Ackerman of Freedom Mini Dental Implants. We are live on location at the Fern Creek location today, and we are taking calls. Our first caller today is Patricia. Hey, Patricia, can you hear us?
Yes. Yes, I can hear you.
Hello.
Hi, how you doing? So my question is, it seems like everything, it's like you never needed dentures or the implant like your regular teeth used to be. So do you have toothache or tooth pain or anything with those?
Right, yeah, so good question. So I think what you're asking is, you know, once you have dentures or you're missing your teeth, do you still have a toothache or pain, you know, with implants? So the answer is no. The only time you'd ever have, you know, pain or is if obviously if there was ever an issue with an implant. But definitely not like when you have a tooth, when you have sensitivity to hot and cold or an abscess. So implants are pretty much like 90% titanium, so they can't get a cavity, they can't get decayed like a natural tooth can. So, you know, as long as those implants heal and integrate how they're supposed to with the bone, then yeah, normally you don't have any, you know, long-term issues. So yeah, that definitely is an advantage of implants over, you know, a natural tooth. So yeah, good question. Does that answer your question? Yeah, okay, great.
All right, so it looks like we have Carol joining us now.
Okay.
That was some great stuff coming from Patricia.
Good question.
Hey, Carol.
Hello. I have a daughter who's 51. She is handicapped and lives in Cedar Lake Lodge. She lost her artificial front tooth upper. And because the brace that helped that tooth onto the other one deteriorated, and they had to remove the tooth so she wouldn't swallow it. Anyhow, they're neglecting to give her another tooth, and I just wondered if you thought an implant in her condition rather than another false tooth would be acceptable.
Yeah, so it's hard to say depending on her, condition, but, if you think she could come into the office and, have the 3D x-ray taken, and we could certainly do a consultation. Like I said, the consultation's no charge, and as long as you think, she can, sit through treatment, if she is a candidate, then we could certainly take a look and see if there's enough bone and if she could have implants in that area to replace those teeth. So yeah, that's just a matter of calling the office and making the appointment for the free consultation. But she would need to be able to stand up for and do that 3D X-ray, and be able to sit in the chair and have treatment done. So if you think she could handle all that, then certainly call and make the consultation.
Well, let me tell you, she's in a wheelchair.
Okay. Can she? I guess. So she can't get into a normal dental chair for treatment? She has to stay in the wheelchair?
Well, I think they put her, she has a dentist out here in LaGrange, and I think that deals with a handicap once a week. And I think they put her in a chair. But,
okay,
and
yeah.
she understands everything
the
you say.
3D X-ray.
Go ahead.
Yeah, because usually we might be able to do the X-ray while she's sitting down, but we would need be able to get her into the chair for the treatment. So yeah, so we could certainly take a look.
I'm sure.
So
okay,
good question. Thank you.
She sits upright, and thank you.
Yeah, certainly.
Great to have the callers.
Yeah.
These are awesome questions, too, that a lot of people are probably thinking. Thanks to both Patricia and Carol. And maybe to help other folks who have questions, we can show some of the models. I know the snap-in dentures are ones that
Yes.
you use a lot.
Yeah, so this is kind of one of the more common procedures I do. It's what we call the snap-in denture. So like I mentioned before, a lot of people are struggling with wearing their dentures. They use lots of glue, or they don't even use their lower denture. They don't even wear it anymore. So this is the snap-in denture. So these are the mini dental implants. These are those small diameter implants. When I place these, I will numb you up, just local anesthetic. I don't put you to sleep or anything. I'm not making any incisions or stitches. So I make like a little pilot hole, and then this is a little one-piece titanium screws into the bone. And a big advantage of the mini implants is you don't have to wait another 3 months for these to heal up. The day I put these implants in, I will put these attachments inside your denture, and you will leave that day with the denture now snapped on to those implants. So no more denture glue. You can eat better. The denture is just way more stable. And then you'll wear it 24/7, but you'll snap it out once a day, rinse and clean it, and then snap it right back in. And then this is an upper denture. I get this question all the time. I can trim back the roof of the mouth some to help with that gaggy feel and help you taste your food again some. So that makes a huge difference with that upper denture as well. So this is one of the most common things we do is the snap-in denture.
It's incredible to see it when you had the titanium right next to your finger, and you can see really how small it is.
Yes.
That this really is a mini, which is totally different than what people are used to.
Yes.
Okay, we've got about a minute left in this break. We have another caller, Joyce. Let's go to her after the break.
Okay.
And before we go, I want to show, we did the before and after on Patricia.
Yes.
I want to show them the model of what she received.
Yeah, so she got the permanent teeth. So same thing as far as placing the implants. I just placed more implants.
And similar size.
Yeah, same size implants, but with this, I'm able to make a bridge of teeth. So no more denture. And then this gets cemented permanently onto those implants, but then you have nothing on the roof of your mouth anymore. These are just like regular teeth. You brush them every day toothbrush, toothpaste. We give you a water pick to keep them clean. So this is definitely the nicest thing I do, and this is going to feel most like your natural teeth. But it's a bridge that gets cemented permanently onto those implants. So biggest thing is you can taste all your food again.
It's incredible the different options that you have depending on what different patients need. All right, we're going to have much more with Dr. Regan Ackerman here live on location at Freedom Mini Dental Implants. We're still taking your calls as well. That number 502-571-5263. We'll see you after this short break. Welcome back to Wave Listens Live. We are live on location today at Freedom Mini Dental Implants on Bardstown Road, and we are giving you a live look inside one of these innovative new treatment rooms, what you could expect if you book an appointment to come see Dr. Regan Ackerman here in the Fern Creek location. Of course, the original location still open on Dixie Highway as well. I want to bring in now Dr. Ackerman, who is sitting with me here in the lobby of the Bardstown Road location, and I know we've been taking calls. We've had several great callers already with questions. We want to go to Joyce, who's the next one on the line.
Right.
Hey, Joyce, can you hear us?
Yes, I can. Thank you for taking my call. Hello, Dr. Ackerman. My question is for my husband. He had 2 molars extracted, an upper and a lower, which were his anchor teeth for his partial, I believe it is, the plates. And that was about a month ago. And my question is, how long will he have to wait for healing process for him to come and have you examine him for the implants?
Yeah, great question. So what I would tell you is to go ahead and make the consultation now so I can take a look and still take the 3D x-ray and just make sure he's a candidate and see where we want to put implants. If we do need to replace those teeth that were extracted, we will let those extraction sites heal up, usually for about 4 months, to ensure that all that bone is nice and solid and good bone before we place those implants. But I definitely would go ahead and make the consultation so I can take a look at bite, x-ray, kind of just get things ready and on track. And of course, we'll go over how this all works and cost and kind of get the ball rolling while he's healing. Sometimes, though, if he's already been missing those teeth in front of, where the partial was, it just depends on the situation, because sometimes I may not even need to replace the teeth that were actually removed. We can talk about how many teeth you want to replace and where, and get a plan together. So definitely would recommend go ahead and making the consultation. And then, but yeah, anytime we're trying to replace a tooth that was missing, we do want usually around 4 months of healing. So good question. We're probably not the only one wondering that. Yes. Yeah.
All right.
So yeah, I look forward to meeting them. Thanks for the call.
All right, our thanks to Joyce with a great question there about her husband, which can lead us into another one of the models here, because you do individuals as well, right?
Exactly. That
perfect segue.
Perfect way to lead. So yes, so we talked a lot about dentures. We talked about all the teeth, but if you're missing one tooth, a lot of people they had trauma, or some people are born without a tooth. I can replace just one tooth with the mini implant. Same thing, and the day I place the implant, you'll leave with a temporary on there. You usually only wear it for about 4 to 5 weeks, but you don't have to, let it heal for 3 to 4 months like the surgical ones. And then we'll have a nice pretty crown, and it gets cemented on permanently, just like a regular, crown, and it stays in. And just kind of like what she was saying, if you have a partial, that's replacing multiple teeth, I can replace 2 or 3 teeth at a time as well. It doesn't have to be just one tooth. So place the implants the same way. No incisions, no stitches, no sinus lifts, bone grafts, anything like that. And then we get the bridge, and that gets cemented on there permanently. So people that are wearing partials or dentures definitely can get rid of those for you. And I know she had asked about the healing process. And we do, always say you'll never be without the tooth. So if you do have to have a tooth taken out, there are things we give you as a temporary to wear for those 4 months while you're healing. But we definitely can replace, 2 to 3 teeth, 1 tooth. There's so many different ways we can use these mini implants.
It's just a perfect visual representation of some of Joyce's questions. Okay, that's going to lead us to our next caller. We have Greg on the line now. Hey, Greg.
Hey, how y'all doing?
Good. How are you?
Doing all right.
Doing okay. I had a question about upper teeth. I was in an accident and had to have all my upper teeth pulled, and they put bone cadaver, I guess you call it, back in there and everything, and said everything's good. What would a normal cost for replacing those uppers be?
It interrupted for a second. Can you repeat your question for me, Greg?
Okay. I had to have all of my uppers pulled, and they put bone back in where they took out some of the teeth, and they said everything's good to go as far as getting some teeth put back in. I was wondering what the cost would be on normal cost would be on putting those uppers back in.
Gotcha. Yeah. So it varies person to person, so it's hard to give you a definitive cost, over the phone. So definitely the consultation is no charge. So make the consultation, and it also depends on what option you choose. The snap-in denture is less expensive and more affordable than the permanent teeth. But what I can say is usually, anybody that's had a quote for the surgical implants, the mini implants are usually about a third of the cost. So, I can't give you a direct quote over the phone, but definitely, make the consultation, and then I can take a look and we'll go over your cost options for sure. Okay?
Okay, thank you. Thank you very much.
Of course, thanks to everyone who has called in today. It's so great to hear from people and hear their questions, and that's what you're here for. So before we let everybody go, let's give them the best way to get in touch with you, as opposed to just coming in here once we clear out of your lobby, of course.
Yeah, so there's a lot of information on our website, which is freedomimplants.com. It's got both locations and our phone number. The phone number is the same for both offices. So certainly call and set up the free consultation, but there's a lot of information on the website as well, and the financing information's on there as well.
Perfect. Always love being here with Dr. Ackerman. Hope you all have a wonderful day.
Thank you.